Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Many things, but they have a special one on centenarians, in which they interview about 10 centenarians. And they all have different philosophies and points of view. So one size does not fit all. So there's more than one way to get to be 100. There was no one theme that was present in all of them. They all had different philosophies.
Were they all positive?
Yes, all were positive. Yeah. That's the one thing they were. They were all positive. Yeah.
Alrighty. Let's see if I can find it. For some reason, it's not showing up on my desktop.
It's coming.
All right, there we go.
This is an interesting article. Can watching sports be bad for your health? A lot of it depends upon who you root for. If you root for a team that's always losing and you like winning, and if you root for a team and they're always behind and come from behind to win, the excitement is great, but the effect upon you and your heart and everything else is something else. Then, of course, those are people who go to football games and have the risk of many things. Those go to baseball games and other things. Risk of heat stroke, dehydration, and then hypothermia, frostbite, and all that stuff. And then, of course, you know about people who died because of stampedes and rival fans fighting each other. So yeah, it has its positive and its negative. But you look at the different sports events. In many ways, baseball is so slow that football is fast and basketball is fast. But you can see here that cardiovascular problems jumped 15% during the soccer games. And it's linked to heart failure and cardiac arrest while watching your team try to win. So, of course, we know that being physically active improves your health. But then, of course, during the course of the football games, the overeating and the behavior of some of the fans in the different weather. Some people wear no clothes in winter. And if you have chest pain, trouble breathing, you take care of it right away. Stay hydrated and don't drink too much alcohol. Yeah.
Dr. Callender, I've always wondered about those idiots at the games where it's snowing and they take shirts off. They don't have any shirts on.
Yeah.
Right.
I wonder how they survive.
Some do, I guess, and some don't, I guess.
It's the alcohol.
Oh, okay. They're preserved.
Yeah.
What do the Wizards do for you, Dr. Callender?
Nothing. When you have a team that loses all the time, it's no problem. You go to see the other teams when they come.
That's a shame, though.
Yeah, well, losing teams are like that. They don't. You learn to accept the losing and make the best out of
You know, the Wizards play well. They just don't play well enough.
it. Well, they haven't won since 1978, so
Oh,
long time.
Almost only counts in horseshoes and darts.
Yeah. Well, this is an article that is very similar to some of the ones we've been reading about recently, and how adequate protein, particularly plant protein, is good for you. Although animal protein is good for you as well, but it also is associated with cholesterol and fats that aren't good for you, and that's the downside of the animal protein. Whereas the plant protein is associated with the good cholesterol and the lack of carbohydrate, and so the plant proteins may be superior in terms of aging to the animal proteins. Although if you have a lean animal protein, then it's good for you. But when you look at the two together, the more plant protein you have, the less carbohydrate and the less fats, bad fats that you have. So, but it's clear that plant proteins are healthy for you. Of course, they don't talk that much about fish and other things, but they're a sort of source of protein as well. But this article is particularly related to the research that they've done on midlife patients. It was a study that we talked about last week. Studied thousands of women in middle age and followed them for about 30 years, and was able to identify that plant protein in the middle age is very good for you and is associated with longevity. Of course, when you combine this with exercise and meditation, then of course together they work for you having a longer, healthier life. Any comments or questions about this in terms of the many diseases that are associated with the 11 chronic diseases and many cancers that are associated with
The only question I have is, they showed a picture of an older senior citizen, and they're talking about middle age. So the picture and what they're talking about, what do they call middle age? I thought that's the 40s, 30s, 40s, and 50s. That's middle age.
Well, 40 to 60 can be, yeah.
60? You're not middle when you're in 60 unless you're going to be 120.
Well, yeah, 40 to 60 is probably middle age. Over 60 is the senior.
Oh, okay. So middle age is growing up.
Yeah, just as longevity is going up.
Okay.
Good morning, everybody. This is Sylvia. There's so many protein powders and shakes, and you don't even know which one to take. You know, everybody's on this kick about protein powder. flavored protein powder, non-flavored protein powder. So, I mean, it's good to know just the plant-based protein powder is better for you, but there's so many on the market.
So true. Any other comments about these articles as we age?
Can I ask Darryl, does he take protein powder as a vegan?
No. Yeah, I
No?
wouldn't touch it because it's okay. Most of the benefits of eating a plant-based diet is that you're getting the fiber with it. Fiber's removed with those protein powders. So that's one downside. The other downside is when they say flavored, they're putting sugar in it.
Mm, okay.
No other comments? Let's go to the next one, please. This is, we had an article 2 weeks ago in which we talked about the fact that people after strokes have a considerable amount of depression. So the question is, which antidepressants would be good for those people who have had strokes? And so this article looks at those that fit this class of antidepressants, and they found that the stroke patients did well, and the effect on the depression was good, and it had no negative impact upon the stroke itself. So that there's every reason to believe that if you have stroke and you get depressed, that you can safely take antidepressants that fall into this class. And in this paragraph, they tell you the names of some of them that fit into this category. We remind you that the two types of strokes. There's the ischemic stroke, where you have a clot blocking off the circulation, and there's a hemorrhagic stroke, where you bleed, and the bleeding destroys the brain tissue. So some of the other antidepressants that they mentioned here can increase bleeding if you already have bleeding.
Dr. Callender, if you're already on medication for depression and you have a stroke, you may have to switch your medication. That's what you're saying?
For example, if you have a hemorrhagic stroke, because some of the antidepressants affect the platelets, and that would increase the bleeding. For an ischemic stroke, probably not as problematic, but for hemorrhagic stroke, that would be a concern. How would they tell the difference? By doing a CAT scan and looking at the brain and seeing whether there's blood or whether there's a blood clot. Okay, let's go to the next one then. There's no comment. This is a problem that is occurring in schools across the country as vaccination rates are declining, and therefore that means kids have increased risk of getting measles. And then, for example, as you have more immigration issues in children who are not vaccinated, then the likelihood of breaks of measles can occur to those who are not vaccinated. You'd like to have 95% of the people in school vaccinated to give you the protection that they talk about, but But that is waning as we have more people who have reasons not to take vaccines. We talked about the herd immunity that occurs when you have 95% of the population that's vaccinated. But if you get below that level, then that herd immunity is depleted, and the likelihood of unvaccinated people spreading the disease becomes great.
Dr. Callender, I thought that at least the measles vaccination was a requirement to get into the school, period.
That's what I thought too, but apparently, if you have a good reason, you might have a reason for not taking the vaccine. So if you have a medical reason for not taking it, you can get in school. But I don't know. I don't know how schools allow people to get in who are not vaccinated, because that is, as far as I know, a requirement. You teachers could educate me more, but I thought, as you did, that it was a requirement. Like 7% were vaccinated. So the question is, what? Yeah, religious reasons, medical and religious reasons. So you have those exemptions, and that's what allows them to get into school even though they're not vaccinated. Some states have philosophical reasons. That's another reason. I hadn't heard that one before. Well, I think that last sentence says it all.
Oh.
Any other thoughts or comments about this article? The world we live in with misinformation and disinformation.
You know, I kind of remember at one point, this is a tangent to what we're talking about. In high school, we used to have an awards assembly, right, for academics. And, you know, those people who excelled academically were applauded. Then at a certain point, they were put down because of jealousy. And we stopped having awards assemblies for academics. And just the people who were getting the awards and their families went to those assemblies. And the kids that were getting them, getting the awards, prior, with all the jealousy and stuff, they wouldn't even want to go up on stage because some of the less smart kids, I'm going to put it like that, would boo them. Isn't that crazy?
Yes.
So it's sort of like the anti-science people are saying, well, these people are getting over on us because they know more than we do, or they think they know more than we do. So anything they say, we're gonna put down because they're smart and we're not.
I remember when I was in high school. I was in honor school, but I would never let anybody know that because I didn't want anybody to think that I was smart. So you have the so-called closet intellectuals who are just like what you said. They don't want to be thought of as smart, because that you want to be thought of as the athletic, not necessarily smart. You want to be thought of as athletic. So that's the anti-science uh, philosophy still is alive. It's tragic that that's the way it was. Uh, but with the schools not even allowing you to graduate from school even though you don't pass exams, and it's kind of anti anti-science, anti-education. So it's something we've got to overcome and get things right in. I think that's the wrong way to do things. But
I agree with Dr. Callender. In our society, if you're good, they call you goody two shoes in order to make you not act good. If you're smart, they called you a nerd, and they had movies and everything. So people cannot be intellectually skewed. And then we came up with everybody can learn.
yeah,
And then, and in our graduations, everybody could ascertain a high school diploma, even go to now it's college and career ready. And so at our schools, when we had the honor roll assembly, they had just the honor roll kids come, not because they were booed, but because, like Dr. Callender said, they didn't want everyone feel that they couldn't obtain, everybody should be on the honor roll. So they started doing the grade scale that you come in with at least 50%. So if you start trying a little bit, you'll be able to pass. Then they started passing kids. Well, he's got a D. He started in with 50%. So if he came to school a little bit, teachers have to write a whole dissertation why they flunked a kid. Now, not because they didn't come, and it is your fault if they do not pass and get a good grade. So they put all that. So teachers started passing kids because they didn't feel like writing a whole dissertation why this child failed. What did you do to make this child not be able to succeed in school? So we got to feel good about ourselves, self-esteem. And if you failed somebody, you have lowered their self-esteem, caused them to commit suicide.
yeah, the bad thing about it is that the people who are of color who succeed, they then say that they succeeded because they were promoted because of their complexion, not because of their abilities. And that's the antithesis of what we need to be about. And so I think school has gone backwards instead of going forward.
If they take the race factor away and stop saying what color you are and just let everybody go on their credentials without seeing their face. Because I know once John auditioning, and they would have them audition behind a curtain so nobody would see what color they were. I know John Buchanan, you probably experienced that too. If you're going into the public sector, a national symphony orchestra, something, you had to go on the screen so they can't say they let you in because you were Black. And then when you would trump over your other race, they'll say it was just strictly their talents, but they stopped that too because they say you have to tell everybody your race. But if you eliminate that little box, what race you are, and you have to apply for college, that would just solve all the problems.
Well, it's interesting at Howard University College of Medicine, they no longer have pictures. They used to have pictures, but after the recent Supreme Court decision, we no longer circulate pictures. So going along with the theme that you just expressed. Did you guys notice that it made a difference auditioning behind screens?
I never had to do it, but I know a couple of people. My cousin Tony had to do that for the Boston Conservatory, and he beat out all the white kids, unfortunately, because he was the best trumpet player. Period.
Well, that's how it should be.
And at Indiana University, I had to audition behind a screen, but it was other than the black and white issue. They had two French horn teachers there. One had more of a worldwide reputation than the other, even though the other had a very national, well-recognized person, nationally. So what it was that the worldwide person, all of his students seemed to be getting all the high seats in the orchestra, like first chair and third chair. Those are the two highest positions. While this other teacher, he got all of his students became second and fourth chair, fourth chair being last place. So part of the screen was to, keep them from catering to one teacher or the other and make it even across the board. Maybe the nationally known teacher could get some people in the high spots, like that. That's the other reason.
Any other comments on this article? Interesting.
Yes,
Go ahead.
Dr. Callender and group. Years ago, when I worked at St. Elizabeth Hospital, which was at that time was under the federal government had come out with a mandate that all pictures of employees had to be removed from the federal personnel folders. And at that time, I was working in the processing unit, and we had to go through all of the personnel folders for St. Elizabeth employees and remove all pictures. And that was because of job discrimination.
Amazing.
Was that just for the employees?
All personnel folders that were kept,
Okay.
whether it was employees, contractors, they could not maintain any pictures of any
Residents.
not residents,
Okay.
just employees.
Okay, thank you. Let's move to the next one. By the way, I got a communication from Dr. Lewis Ivy, who is going to join us perhaps in the coming weeks and months.
Oh, cool. That's cool.
Yeah, hasn't been with us for a while, but he's planning to come back with us and join us again. He has been following us and following the videos, but he hasn't been in person for a while. Now, this is an article that is trying to get people to get to the pre-pandemic levels of cancer screening. As we know, breast cancer, colon cancer, and other cancers, when found early, can be aggressively treated and sometimes cured. Since COVID, many people are not getting their screenings, and as such, the likelihood of cancers being found early has decreased. And if you have late cancers, then the ability to treat them appropriately is lost. And so it's a cry for us to revert back to pre-pandemic levels of getting breast screenings, mammography, colorectal screenings, and PSAs and the like, which have declined since the pandemic. So an ounce of prevention is still worth a pound of cure. And an earlier diagnosis of cancers beats a late diagnosis of cancer. Any other comments about this article, which is an important one because the earlier you find out that you've got high blood pressure or diabetes or cancer, the better off you are.
Yeah,
I
I've
had a
got a
question,
comment.
Dr.
John Buchanan, can you scroll up to the top of the screen? The top of
Sure.
this article? Yeah, my comment is I love the doctor's hair. I think it's beautiful.
It's unusual and positive. They're beginning to allow that. In the old days, they would never have that picture.
Speaking of pictures, I had a question though. There was a very popular country singer composer who I think died because of stomach cancer, and they were talking about uh, that stomach cancer is treatable. It if it's caught early. How would you know if you had stomach cancer?
One of the ways is that early early satiety, which is a term for when you eat and you get filled up quickly, uh, it can be a sign of cancer. Also, pain in the stomach or throwing up can be a sign of cancer. But one of the earliest signs is when you used to eat a lot of food and then now you can't. You can only eat a small amount of food before your stomach fills up. Uh, and uh, and then because pain in the stomach is another sign. And then of course having black bowel movements is another sign of cancer.
So someone who had those symptoms would just be afraid to go to the doctor and find out.
Well, you should go to the doctor because if you make the diagnosis early, you can treat it early because they can um, sometimes the can be upper, can be stomach, or it can be esophagus, and sometimes it can be treated by a number of different ways by radiation as well as surgery. But the earlier you make the diagnosis, the more likely you're able to treat it successfully by radiation or surgery.
Alrighty.
Did you understand what I meant by filling up early? In other words,
Oh yeah. Oh yeah.
okay, all right. Any other comments or questions about this article? If not, let's go to the next one, please. I thought this was a very interesting article because Tai Chi and many other of the Eastern health practices have been demonstrated to uh, positively influence your health. So that, yeah, breathing has long been um, uh, shown to have some positive effects on your lifestyle and your health and longevity. And so, and many of the recent uh, health studies of thousands of people have demonstrated that breathing can affect our health and well-being, just as exercise can. Similarly, uh, breathing can affect your well-being and reduce stress as well. So that the answer is yes. And this has been studied for centuries now, and it's gotten to the point where uh, all of the physiological uh, studies demonstrate that modifying your breathing does improve your health. Any of you use Tai Chi or any of those breathing techniques? Yoga, they do that in yoga too.
Yes. Most of the time, our yoga instructor will have us center and just breathe almost like 5 minutes before the rest of the physical part. Just to focus on three-part breathing, the diaphragmatic, the center of the chest and the upper chest. Control breathing, and then after that you go back to your regular breathing. You can control the exhalation by using they call it the ocean sounding breath, where you act like you're fogging a mirror with your mouth closed. You close your glottis and like that. You can slow down your breathing, and I'm telling you, it'll take you out of whatever you're into, whatever's going on, and you focus on breathing. That becomes it. That's your focus. And at the very end, when you do shavasana, that's where you're breathing normally, but you're able to reach that meditative state.
Do you get high from doing that? That's
Uh,
what they asked down there.
I've never done that. I've read books where people can get to that point, but I've never done that.
In physical therapy, they teach us to breathe in through your nose rather quickly and then breathe out slowly out of your mouth. And so I don't know why that is. I thought, that when you're breathing in through your nose, somehow the air is filtered in your nose because of nose hair or whatever. But then when you breathe out slowly through your mouth, you're putting any kind of aerosol germs out of your body in your nasal capacities.
I think that they call it tapping into your vagus nervous system. And I just accept that. The vagus nervous system can help you to relax. So at least in yoga, that's what they talk about.
I used to do yoga on a regular basis. And the first thing we did, breathing. And I said, oh, I can't do that. I have asthma. And I felt like I was always rushing to catch that breath. And generally going to a class, you are rushing to get there. And didn't matter. Everyone had to lay there, but her voice and the sound, take a breath. And I felt like we were all over the place. And it didn't take long. Calming the body, relaxing the body. And it makes the performance better. You can do it everything else if you start off with that quiet period of breathing. So I do that a lot now when I'm involved in stuff. Okay, you're rushing. Take a step back, just breathe. And it makes a big difference.
One thing I found out, the same thing that Janice was talking about when we go out to do the health fairs and we do blood pressure screenings, that I've learned that if they take a minute, take a couple of deep breaths, and that help the circulation for their blood, but that also calms them down. And when we take the blood pressure and we ask them to do that, their blood pressure readings are much better.
You know what? The other thing, playing a wind instrument seems to be perfect for that kind of exercise because you take air in through your nose and you breathe out of your mouth into the instrument. So that seemed like a perfect, that looks like musical therapy, all wrapped up into a nutshell.
And to dovetail with that, vocal training does the same thing. Learning how to involve diaphragmatic breathing. And I remember, teaching the brass section of the youth orchestra. We would do the diaphragmatic breathing. We'd hold notes for like 60 seconds almost. Also for scuba, one of the skills that we work on is breath hold, being able to hold your breath for 30, 40, 50. I've gotten up to 90 seconds of just holding my breath. That's not diaphragmatic breathing, it's just breath hold, but it definitely relaxes you, that's for sure.
That is a good number, though, 90. I've never been able to get higher than 60 seconds.
Also, deep breathing is also good when you're doing your exercises. It helps your exercises to become more effective for your
Yeah,
body.
that's what they told me at physical therapy as well. Yeah.
All right. Next article, please. Well, this is prior authorization has been a source of discontent for patients and physicians alike for at least the last 30 years. And the problem is that they may hold up admissions to the hospital. They may hold up the ability for you to have surgery because you have to have prior authorization in order for you to be admitted to the hospital, in order for you to have surgery, because they have to be sure that your insurance is going to pay for your procedures and the hospital admission as well. Finally, the CMS has recognized this and has implemented rules, a final rule that will reward the system if they move quickly on this. But this has been a source of discontent quite a while. I don't know if YouTube will play. You want to give it a try, John?
The only reason I would suggest not is because it's like 14 minutes long.
Oh, too long. Okay. All right.
So if we have time, we could do it at the end.
Okay. All right. And the essence of it is that this will go a long way towards speeding up the way in which you can get your surgery approved, and also improve the ability to admit patients to the hospital without wasting a lot of time and effort. And so it's very desirable that it has finally been changed. So let's go to the next article and we'll come back to it if we can.
Okay, just before that, you could actually take your mouse and take it up to that URL there for YouTube and click it and come back to it, when we're finished.
Yeah, right.
And
Good. Thank you.
I think I can copy it and put it in the chat. Well, I might not be able to copy it. Let's see. Yeah, I can put it in the chat as well. Let's see. Save. All right.
Okay, let's go to the next one then. This is an article that talks about the effectiveness of the COVID vaccine to preventing the symptoms that are part of the disease entity. And it shows it's 54% effective, which means 46% of the time it's not effective. So I don't know how many of you have gotten any, because I think all of you have been vaccinated. I don't know how many of you had symptoms of COVID since you've been vaccinated. Any of you? Apparently no one. So
Good morning, Dr. Callender and everyone. Dr. Callender, what is this that people are saying they have long-term COVID?
well, long-term COVID is a situation where they have COVID symptoms for longer than a month, and sometimes have as long as a year. And there are many, probably about 10 to 15% of people who get COVID actually have long COVID, which means they have the same symptoms, fatigue and all of the other signs and symptoms of COVID for months, and maybe as long as a year. And this is thought to be a problem that still is not well understood, but it is an entity that does exist. And I think some of our clientele have talked about some of their friends who have had long COVID.
It lost the taste and smell for a year. Can you imagine that?
No.
Of course, that's the least of it. Just losing taste and smell is the least of it. The others have COVID symptoms for months, especially
Dr.
fatigability, easy fatigability.
Dr. Keller, I want to ask if a metallic taste in your mouth is related to COVID.
Not as far as I know, but I don't.
I heard that the metallic taste comes up when you use Paxlovid, that treatment.
Yes.
Yeah.
Okay.
Actually,
Dr. Callender,
yes.
I had the only reason I knew I had COVID was because I had the lack of smell, and I didn't have any other symptoms. And my 93-year-old aunt that I take care of, she didn't have any other symptoms. But we took a test, and we had it, and we used the Paxlovid, and that's what made everything taste metallic to us.
Mm.
But the only she didn't have any symptoms at all, and I had no taste, no smell, and that's why I figured that I had COVID.
Thank you for sharing.
Mary Ellen, how long did you have those symptoms?
Well, we tested positive no taste for 3 days. Once I started taking the Pavlovid, it went away, but then I couldn't I could smell, but I couldn't taste anything because the medicine made everything taste like metal. So I switched one symptom for the other. But once I started taking the Pavlovid, the smell came right back.
How long did the metallic taste last?
As long as I took the medicine, 5 days.
Okay, all right.
It went away as soon as I stopped the medicine.
Okay. Well, of course, the data that is still problematic is that only 22% of United States adults have gotten the shots. It's sad commentary. This is an article that's very appropriate and timely because gene editing and healthcare are now part of today's practice of medicine. We've talked about CRISPR-Cas9 for quite some while, CRISPR-Cas9 for quite some while, and this is the newest thing in gene editing. We've talked about how this is being used to treat sickle cell disease and thalassemia. But we've also identified that the gene editing can be used to eliminate certain genes that produce conditions that are fatal. And so this gene therapy promises to be helpful in the treatment of cancer and other genetic diseases. It also will likely allow for us to have successful xenotransplants in the very future. The only thing that we really aren't that clear on is what is the 5-year downside of having gene editing. In other words, yes, we know that it will do away with that gene that caused fatal disease, but is there any other side effect from the gene editing. And we haven't been doing it long enough to know what will happen 5 to 10 years after that. But we do know that it's here today and it's helpful today, and is more likely to involve other areas that have not been involved at this point as we go on, because it has so many benefits. I think as we look across so many genetic diseases, and so you can see that editing those negative genes out could be a brighter tomorrow for many people who have genetic illnesses. But the fact that CRISPR-Cas9 was the Nobel Prize winner for in 2021 is likely to have ramifications for the next 20 to 30 years. I think it's only just beginning.
I've got a real fear of what could happen, especially thinking about some of these rogue countries like Iran and North Korea and China even, what they might do with this technology. And I remember, anybody remember that movie, The Boys in Brazil? I think was the name of it, where they did some cloning, and somebody got some DNA from Hitler and made a bunch of Hitler clones. Also Gattaca, how someone selfishly wanted to have an improvement on his genetics so he could be an astronaut, and had it done. And I mean, the ethics involved in this are frightening to me. The possible. I mean, there's all sorts of positive things, but there's also a negative side that, it's just like when the first clone sheet came up, people said, what? How can that be? And now all these other possibilities are coming up. It's really something to think about.
That chief's name was Darryl.
Any other comments about it? This is revolutionary, and it's appropriate to have some discussion on it, the ethical aspects as well. Just because we can do it, does that mean we should do it? That's the question that people have. And if you have a disease like sickle cell disease, thalassemia, you'd probably answer yes. But if you have a fatal disease that gene editing can make no longer fatal, you'd probably say yes. But the real question is, what is the downside of this? What happens to you 5 years after this? Nothing, something, or what? And none of the answers are evident yet. So time will tell. And it's a cause for concern, but yet it's a cause to celebrate in terms of it's accomplishing so much good. Any other comments?
In the early 1900s, there's comments about the automobile. They said there could be car accidents in the future. Pedestrians could get run over by cars.
Yeah, and of course, the number one cause of death from trauma is probably automobile accidents. They were right. Yeah, but look at all the good that happens. But
Dr. Callender.
yes.
There are ethical considerations, but they've already been reached a lot of times when they started having sonograms, when you could see the sex of a child. Over in India, they had sonograms that were administered by non-medical people, but people would go in to see if they were having a boy or a girl, and deciding on which one they wanted to have, then they could have abortions early because they knew the sex of a child. And this gene thing, it could eradicate some things such as Down syndrome. And I had a friend one time who had a had a sonogram, and a amniocentesis, and they discovered that she was going to have a Down syndrome child. And she milled over whether or not to have the child or have an abortion, and ended up having she had a miscarriage because of the amniocentesis. So she wasn't, she wasn't able to make the decision before that happened. But what I'm saying is there are some communities that have learned to accept the disability, like deaf people and people with Down syndrome, and they probably would take affront to people uh, wanting to eradicate their conditions. So that would be something to think about also.
Any other comments? Okay, well, we shall see. We had these discussions last week about the microplastics as well as the phthalates, and now the EPA is proposing that some of these chemicals be considered hazardous, since they found these products in 96% of the human population. So it's kind of late to worry about it, since the deed has already been done, to be honest with you. So it's interesting that now they're talking about saying they're hazardous, but it's kind of late for us to talk about it being hazardous when 96% of the human population is already contaminated. But it's such as it is. Any comments on this? Is it too late? Or what? What are your thoughts?
Maybe it's not too late for the next generation, but for us,
Well, it's probably too late, because the children are probably the generation after them, because the children who've been born already have the flashes in their
yeah.
bloodstreams.
Yes. Well, I
And
guess it's never too late for any kind of improvements, if this is an improvement.
well, the question, is it too late? Actually would have to be for which generation? Because this generation, you'd have to wonder if it's too late, if you have we've already been exposed. Children's children,
Yes.
our children's children. Yeah.
Mm.
And then
Children's children.
more than 12,000 forms of these PFAs in the environment. And
Mm.
and they're accusing it of being associated with diabetes, obesity, cancers, and many other things. Any other comments about this? Is another interesting subject that is timely to discuss, and especially as your comment is, it's better late than never, and what else can we do about it? So it's a timely subject.
Dr. Callender, it seems that this is totally parallel to the gene editing, except our genes are being edited by industry, and there's absolutely no control for us with that.
Well, gene editing is controllable. These phthalates are not, but gene editing is. I mean, they have an advisory committee that identifies conditions under which gene editing is allowed for and conditions under which it is not allowed for. So there is some sort of a way of controlling, but these other issues that we're talking about now, hard for me to see how we can control those.
I agree.
Any other comments on these very fascinating articles, which sometimes are more frightening than illuminating?
How long was it before they started sounding the alarm bell? Did they know about it?
They're doing it now.
Okay, so they just discovered it, and so they sounding the alarm button now?
Yes,
Okay.
when 96% of the population is already affected by it. So now this is a hidden killer, radon. I don't know how much you know about radon gas, but as you can see here, it's an invisible, naturally occurring radioactive gas. It's found wherever you have buildings. And so therefore, how many of you actually know whether you have radon in your house or not? Because the uranium and radium breakdowns in rocks and soil, and they make their way into homes through gaps around pipes and cracks in the basement. So that this is another hidden killer. How many of you actually test for radon in your houses? And these radioactive substances can produce strokes and many other things. And so those people who are in the know, they have radon meters that measure the amount of radon in the house. So that theoretically, residences should be testing for the radon gases. Are you? I'm not. Are you? How many of you are aware of radon?
Yeah, I'm aware of it, and you have to be aware of it if you're going to sell your house because they'll test it for radon, and you have to remediate it if you have a radon problem. I lived in a house that I bought in 2003 that was tested for radon then, didn't have it. But when I sold the house in 2020, uh, it had radon, and so I had to remediate it. Um, but I spent most of those 17 years in that house in the basement. So I guess I had a long-term exposure to radon. I wish I'd had a radon meter where the alarm would have gone off once I had dangerous levels. So I'm in another house now, and it's probably something I should check into to see if that's possible to get a radon meter.
Do they have radon meters?
Yeah, they do have them. I don't have one in my house, but they do have them.
Yeah.
Uh,
When I sold the
I think,
house, yeah, the radon inspection people left left the radon meter in place for 48 hours to determine I had a radon problem.
Well, this is new to many of us, so I think this is good for us to know that this entity exists and another toxin for us to be worrying about. This is an article that is no surprise to me, but medical students are not psychiatry students. May not have a clue about what to do about suicide. And so I know in my classes, I emphasize in my course on professionalism, I talk about the fact that what to do when you encounter a medical student who is suicidal, because most people do not know what to do. And one of the things that you have to be committed to doing is to immediately take somebody like that to get mental help, because otherwise they might kill themselves. And since suicide rates are increasing among all except some of the very young people, and they are actually increasing in teenagers of color. But medical school does not teach many of our students about how to deal with suicide. And some people think that if somebody tells you that they want to commit suicide, you can be confidential and keep that as a secret. When in point of fact, that's the worst thing you can do. You have to really get that person. I think we talked about this before as well. And taking the person to the emergency room, or taking them to the suicide hotline, or other things that you need to do as soon as possible. We have a suicide hotline now, and we have other things, but that doesn't mean that in medical school that we're teaching them about what to do with suicide. And so you've got to do more. And so it is accurate to say that many of the medical students are ill prepared to deal with somebody who's suicidal. And that's the sad commentary on medical school. And I don't think there's any area where it's unsafe to talk about suicide and how to deal with somebody who is suicidal. Any comments about this very serious topic?
I have a question, Doc. This question at the top of the screen: why do so many Americans take their lives shortly after seeing a primary care provider? I was thinking about that. So you go see your doctor, and your doctor tells you you have a fatal disease or fatal illness, and some people can't deal with that and take their lives. I think that has something to do with it, possibly.
Yeah, possibly. Any other comments or thoughts? It's a very cogent topic. And if you have any people who committed suicide that you know of? We've had medical students, medical residents, and nurses who committed suicide. I have one of our ministers who committed suicide. So suicide is everywhere.
I had a friend that committed suicide, a young person. And it's so sad because nobody believed him. He told people he was going to kill himself, but nobody believed him.
Any other sharing you want to do? John told us about his experience. John Buchanan told us about his experience with one of his students, which I'll never forget after hearing it.
Yeah, this kid shows up. He'd already graduated like 3 years before, showed up at my junior high school band rehearsal and stuck around. After band rehearsal, all the kids had gone, and he shared he had a relationship issue. His girlfriend quit him, and she was pregnant with his child. And I didn't pick up on it, but I felt very guilty afterwards, because the next day he hung himself.
Wow.
I felt a lot of guilt. I sat there and talked to him, but I didn't pick up that he was suicidal. I knew he was upset, but kind of hard to deal with.
You don't know how people will respond when you hear devastating news. My sister's friend, one who passed recently, he was told that he had a year to live. He was the one whose heart stopped for 25 minutes. They worked on him, brought him back. We thought he was doing fine, but he kept having problems, falling and just different things. He was in and out of the hospital. But when he was told by the doctors they gave him no more than a year to live, he fell to pieces. I mean, it was very hard for him to take, and we thought he was regrouping and, enjoy life. That's just a number, trying to get him through. Then it became bitter. And then he made some irrational decisions, had a real nice truck, and I think the dealership took advantage of him. We tried to tell the dealership that he wasn't well. And he had this real nice, fancy new truck, came home with an old smoking, older Jeep. And we had to convince him, you can take this back. They have this forgiveness rule or whatever that rule is. And no, I'm not going to do it. No, no, no. And I've never seen him like that. And my sister and I finally convinced him to take it back. The dealership said, we'll talk to you, but you're not getting this truck back. And when we got there 3 hours later, the truck was there. And he loved that truck. But why did he make that decision? And then you can't blame the dealership, because we said, show us in writing. And they showed us the contract where they don't have the forgiveness rule or whatever that is. And just a matter of strange decisions that he was making. And it turned out he didn't last that year. He had a heart condition, was in the hospital Christmas night. He passed because he aspirated on his vomit. I know it may or may not be related. It just goes to show how things happen in your life you have no control of. And I think in his life, he just went down from hearing that comment. We give you a year to live. So you just don't know how you're going to respond.
Anybody else want to share?
Good morning again, Dr. Callender. I was exposed to a former student that committed suicide. In elementary school, when kids go to junior high, they always come back to visit their elementary teachers. And so this particular student had come back to me about 3 weeks prior to, and he was sitting talking about the teaching methodology and students and stuff. And he asked my advice, and I gave him some advice, and I said, try it this way, try it this way. And he was saying, Miss Dorsch, they don't teach like you. I said, well, that's just life, okay? So I gave him some good advice and everything. 3 weeks later, he came back, but he was looking for the science teacher, and she wasn't there. And so he went downstairs, and when I was leaving out, I said, did you find her? He said, no, she's not there. I said, okay, anything I can help you with? No, Miss Dorsch, not this time. I said, okay. The next week he committed suicide. And I often wondered, I knew his personality. I knew he was gifted. And it's always in the back of my mind, should I have talked to him more? But he was looking for another teacher. I said I didn't take time. I took time with him prior to when he wanted to talk to me, but he wanted to talk to the science teacher. But that does bother me from time to time.
Any other sharing?
Perlene is online, Dr. Callender.
Hi.
Hi, you made it. How about that?
Finally.
Good to hear your voice again.
Thank you.
Been a long
Yours too. Yeah.
Yeah. Well, welcome. It's been a long time.
Thank you. Thank you.
Yeah. All right.
Joyce, What time do you have to leave?
She's left. She just left.
Oh, Joyce is still left already?
Good to see you, Pearline.
Oh, you're still here. Okay.
I'm getting ready to leave now.
Okay, nice seeing you, Joyce.
Okay. This is another article that actually was news to me, that white bagging is a term they use for a situation where the oncologists are required to get their special drugs from specialty pharmacy, which may be more expensive than going the routine fashion, which is where they give the drugs to the physician, and the physician then takes care of the medication getting to the patient. And what the problem is that when you get it from the specialty pharmacy, they charge a little bit more than other things. And so this then is something that I was never aware of, that specialty pharmacies were more expensive than other ones. And so this practice is something that they're trying to stop, because often these drugs can be obtained directly from the distributor at a much lower cost. I don't know if any of you have been on oncology service and had to have infusions of medications. But this is just in case some of you have relatives or friends that this now has come to light, and they're trying to really do away with this practice, because it's increasing the amount of money that patients have to pay for their medications. As you know, recently the government is now negotiating with big pharma to reduce the exorbitant prices that they charge for some of their medications. And so this is in concert with that, which makes good sense to try to do what you can to decrease the cost of medicine wherever it is, because we know that research costs a lot of money, and that big pharma is spending a lot of money on research to get the best possible drugs. But there may be a limit. Some people believe that the billions of dollars that these companies made off of vaccinations is another example of big pharma going wild. But it's probably is not to say that it isn't safe. It's just that it's costly. So this is something that in all areas, as there's an effort to decrease how much money we spend on medications, that wherever we find these practices, they need to be addressed. Janice, you had a comment or no?
No.
Okay, well, I guess this is probably not an issue that any of our people are confronted with. So
I have one question about it though. You got the insurance companies on one side, you've got the hospitals and healthcare staff on one side, and you got the patient in the middle. So sometimes I'm trying to figure out who's trying to help whom, because the hospitals are, as you mentioned, are trying to fight big pharma. So that would be on not only on their behalf, but on behalf of the patients. And the insurance companies seem to me are the ones that are trying to make money off of everybody.
Well, actually, that's not really the case. The insurers actually are trying to decrease the amount of costs. So they would like the negotiations to proceed. So it's not the insurers so much as it is the big pharma having what some people think are exorbitant prices, although the big pharma says that's the cost of research. Uh, but the but it is true that the patients and the hospitals are both caught in the middle. The insurers are caught also. So it's big pharma and the insurers who are battling. The insurers are battling to decrease the cost of medication, and big pharma is battling to keep the cost the same. The hospitals and the patient are caught in the middle.
Yeah, got it.
I had a question, Dr. Callender, about infusion. So if somebody's on infusion medication, do they do that themselves? I thought they had to do that at the hospital or at the doctor.
Most of them do it in the hospital.
Okay, so how would that work? They would get the medication and take it to the hospital, or the hospital would give it to them?
The hospital would generally give it to them, but what they're saying is that sometimes the doctors are required to get the medicine from specialty pharmacies, and the specialty pharmacies have a higher cost than the distributor or manufacturer of the drug. And so that's where the rub is, that you might get it cheaper at the place of distribution rather than at a specialty pharmacy place where the price is higher than that. But most of the time, the infusions are given in the hospital, the outpatient clinics. Okay, let's go to the next article. Well, it's you know it's interesting that we're talking about so many sources of toxins, and now we're finding out that the air we breathe is causing us to have heart attacks as well. And so ambient air pollutants increase the risk of heart attacks. So where are we safe? You almost say it's nowhere because we know that the pollutants give you heart attacks, they give you cataracts, glaucoma. This, of course, is a UK study, and it is likely to have consequences here in the United States. But it's food for thought that the air we breathe is another source of toxins. I'm sure that's no surprise to anybody, but
I'm looking at something. I had a question about, was the quality of indoor air or outdoor air worse? And Google says indoor air can be 2 to 5 times more polluted than air outdoors. And I was thinking the other way, that I should mask up when I go outside, but I guess I should just mask up 24/7.
Yeah, that's interesting. I'm surprised by that 2.5 inside more toxic than outside. I'm shocked to hear that as well.
Dr. Callender, can you repeat what you said about air pollution and its effect on the eyes?
Yeah, there's another article that points out that the air pollution is related to glaucoma and cataracts. We know the ultraviolet rays cause cataracts, but they're also associating glaucoma with it, as we know. And a recent paper we had discussed shows that glaucoma is twice as common in people of color. And so the fact that you can increase that by air pollution is a concern as well. But I think Darryl's point is even more frightening, that 2.5 more toxic than outside. It's kind of scary.
Speaking of scary, you heard where the I think it was Louisiana, I'm not sure what state it was, executed one of its death row inmates with nitrogen.
Yeah, that's right. We had that. It was one of the papers we didn't have a chance to get to, and some of the people who witnessed that felt that he was suffocated, and that's a cause that is going to be cause considerable discussion, because this is the first time that that has occurred. And
Yeah, that was Alabama.
it was Alabama. Huh? Okay. No more comments about Alabama.
Yeah.
Yeah.
Well, up until then, Alabama had been using the electric chair.
Hmm. Wow. Yeah. Well, apparently, whatever they used before didn't work, so they used this new way of doing it, and it has been associated with many complaints that are going from bad to worse.
You know, what's weird to me is that most of the air we breathe is nitrogen anyway. A lot of people think that it's oxygen, but vast majority, 66%, I think, of the atmosphere is already nitrogen. So I'm just wondering, so are they killing someone with nitrogen or the lack of oxygen?
Both.
Okay.
Yeah. Okay, is that the last article, John? No. This is an important article. We said this all along. A lot of the white doctors had said that PSA screening is unnecessary, and now we're coming back to what black doctors have said all along, that not only should PSA screening be done, it should be done earlier, between the age of 40 and 45, and should be done annually until the age of 70. Uh, that may not be true for white men, but it is true for black men, that PSA testing should be done annually for black men until they reach the age of 70, to make an earlier diagnosis of prostate cancer, because we have such a high incidence of prostatic cancer. Benign prostatic hypertrophy is something that is common in virtually all men over 70, but cancer is also very common. And of course, cancer occurs after 70, after 80, and after 90. So men being aware of their prostates and getting PSAs and rectal examinations to examine their prostate, or they have x-rays of the prostate that can obviate the rectal examinations, MRIs of the prostate. But this is something that they're finally recognizing, that they gave bad advice to black men relative to the importance of PSA. Any comment on this?
My comment is that my dad died when I was 55, and one of his conditions was prostate cancer. And that's the same age I went on a vegan diet to lower my PSA. My PSA at the time was 2 something, and went on a vegan diet, and my PSA has been consistently under 1.
Any other comments? Anybody want to share anything else?
A friend whose friend was diagnosed with prostate cancer. And the doctor said it was early stages. We're not going to do anything right now. What does that mean? Cancer is cancer.
Well, there have been some studies that have demonstrated that if you have a cancer that is low grade, that you have a 95% chance of dying from something other than cancer within the next 5 to 10 years. So some doctors, if you have a low grade prostate cancer, have decided to not treat it at all. That's, as I said, some doctors. So I don't know the particulars about the grade of his cancer, because there are high grade malignancy and there are low grade malignancies. And I wouldn't know which one that your particular friend has. So that yes, there are centers for which if you have a low grade prostatic cancer, that they don't treat it at all. And there are centers where they treat it. So
Age wouldn't impact on anything like that, would it?
well, the aggressive nature of the cancer is what matters more than the age, because you at the age of 90 you can have an aggressive cancer. So if you have a cancer that is not aggressive, then they may decide to treat it differently.
Okay.
Okay, it's 10:30, so I guess we have to save the next one till. This is an interesting article about whole blood transfusions and preference to packed cells and fresh frozen plasma, indicating that sometimes whole blood transfusions are better than fresh frozen plasma. This is a new concept that really has just come out, and research has demonstrated that this is the case. And as you know, there are people who give fresh frozen plasma. People who give platelets, and they give component parts of the blood. But it appears that the whole blood is better than the other. So that's what this article is all about. So, especially people who have traumatic accidents and they need blood. This is suggesting that the best transfusion is a whole blood transfusion rather than its component parts. Okay, let's close it up now. Thank you so much for coming today. So many of you came and participated.
I have a question, if we can, Dr. Callender.
Yes.
Off script, something that's happened personally in my family. My niece was recently diagnosed with absence seizures, and it puts you in an altered state. She'll hesitate, she'll stop. It's like she's blanking out, seconds come back. She's 5. Her grandmother noticed it, told her daughter, you know, some kids, oh, mom, she's fine, she's fine. Finally, she mentioned it to a pediatrician, and she was referred to Johns Hopkins, and they diagnosed this. And they said it sometimes happens between the ages of 4 and 6, but it can continue through puberty. She's 5, active, well, doing good in school. And I know we have a lot of educators on, have they ever experienced that? And have you ever dealt with that?
Petit mal is what we used to call it, where you stop, because the grand mal is where you have the seizures. And petit mal, you just pause.
Yeah.
Then you wake up again.
Yeah.
So it's another name, but it's the same disease entity. And the question is whether you need to be treated for that. In the old days, they would treat you on Delantin and other anti-leptic medications. But I don't know whether they've chosen to do that with.
They've given her medication, something she has to take twice a day. And I think right now it's a pill. And of course, they advised her to talk to her teachers But she's very bright. And the other thing, two things happening. She doesn't eat. She'll be fine not eating at all. So now they're sending her to a nutritionist.
Yeah, anorexia is I don't know if you know about the Carpenters, but she had anorexia nervosa and she died from it. So if you don't eat, you're going to die. So
yeah.
so it's important for it to be treated.
Okay.
Yeah.
Okay, good. Thank you.
Okay. Thank you very much for showing. So good to see Berlin Freeman again, and welcome again. It's good to see you. And I know you called me yesterday. I was in a meeting, so I'll have to call you back later on. Okay. All right.
And
Okay.
Berlin,
Well, so see you guys next week.
all right.
Berlin.
Thank you, Dr.
Give me
Callender,
that
for calling
number,
me back.
Berlin, that I gave you.
Thank you.